So we're diving into infection prevention today.
Really exciting stuff.
Yeah, and you've sent in some excerpts from the APIC chapter on process control charts. Sounds like you're looking to really get into the data side of things.
For sure.
So that's what we're going to be focusing on, is how infection preventionists can use these charts to really track and hopefully prevent HAIs,
Absolutely.
All about using data to keep those patients safe.
That's the goal.
It is. So
you can kind of think of it like being a detective.
Oh, I like that.
Yeah, but instead of a magnifying glass,
we're
using data to find clues that might lead to outbreaks.
Okay, love that analogy.
Thanks.
So can you give us a quick overview of what Statistical Process Control, or SPC, is all about?
SPC is basically understanding the heartbeat of your infection data.
Ooh.
So like seeing the normal ups and downs, the rhythm of your facility.
Yeah.
And being able to pick out those irregular beats that could mean there's a problem.
So that makes sense. And in the real world of an infection preventionist, what kind of data are we talking about?
Well, think about the common HAIs that we track all the time.
Yeah.
Surgical site infections, CLABIs, CIUTIs, VAPs.
The whole gang.
Yeah, the whole gang. We're always looking at those rates for the whole hospital, but also specific departments.
Okay.
And SPC helps us know if the rates are just doing their normal thing, or if there's something new that we need to pay attention to.
So it's not just about knowing the numbers.
It's knowing what they mean.
Yeah.
Right, exactly.
Okay.
So it's about knowing what those numbers are telling us about how well our infection prevention practices are working.
For sure, for sure.
So one way to actually visualize this data is by using a run chart.
Run charts.
Yeah.
I've seen them around.
I feel like they can be kind of mysterious.
They have felt a little mysterious, honestly.
They're really not as complicated as they seem. Think of it like a line graph that tells a story over time.
Okay.
The center line is like our baseline.
Right.
So the median rate of infection, you have your time period, usually months, along the x-axis.
Right.
And then the infection rate on the y-axis.
Yeah.
So the plotted points show us how that rate is moving over time.
So like a timeline of infection trends, basically.
Yeah.
Okay.
And like with any good story, you're looking for those plot twists.
Oh.
So like a sudden spike in infections or a steady climb. That's a red flag.
Okay, so what kind of plot twists should we be looking out for?
Well, run charts have a couple key rules. One is the rule of 7.
Okay.
If you see 7 or more data points in a row that are all above or below the center line, that's when you raise an eyebrow.
Ooh.
It could be random, but it could also mean something's shifted in the process.
So a signal to dig a little deeper and see if there's a reason for that trend?
Yeah.
Okay, what other rules are there?
There's the rule of 5.
Where if you see 5 or more points that are steadily increasing or decreasing, that's another sign something could be up.
Okay.
And then the rule of 14 looks for 14 points that are alternating up and down.
So it sounds like we're basically looking for any pattern that deviates from that.
Yeah.
Expected up and down.
Yeah, so run charts are really good for a quick visual check.
Yeah.
And for noticing obvious shifts.
Okay.
Especially if you don't have a lot of data points. But when you have more data, say 25 or more points, then we can use the control chart.
Oh, the control chart. This is the big leagues now.
This is the big leagues. Control charts give us a much more nuanced view.
Okay.
They can actually distinguish between the normal variation that's always in a process, what we call common cause variation, and those unusual blips that are caused by something external, special cause variation.
So it's like a run chart with a superpower.
It can see both the normal stuff and then the real signals.
You got it.
Okay.
So the control chart looks similar to a run chart.
Okay.
We've got our time period on the x-axis, infection rate on the axis.
Yep.
Each data point marks the rate at a specific time.
Okay.
But here's where it gets interesting. We add upper and lower control limits.
Oh, yes.
And those are calculated using standard deviations.
Standard deviations, I vaguely remember those from stats class.
I get it.
What do they mean in this context?
Essentially, they show us the expected range of variation based on our data's history.
Okay.
Think of them like guardrails.
Gotcha.
So if a point falls within the limits, we can usually assume things are normal, just common cause variation.
Okay.
But if a point goes outside those limits, that's when the alarm bells go off.
That's when we gotta pay attention.
It's a sign that something out of the ordinary could be going on.
Okay.
A potential special cause that we need to investigate.
All right.
And control charts have a whole set of rules for detecting these special cause variations.
Okay, lay them on me.
Well, the most obvious one is any point going beyond the control limits. That's a clear signal.
Right.
But there's more to it than that.
Okay.
We also look for subtle patterns within those limits.
Like what? Give me an example.
So a point going over that upper control limit, that's a clear signal.
Right.
But what if you have a couple of points getting really close to that limit?
Okay.
Or a cluster of points that are kind of huddled above the average line? Those patterns, even if they're still within the limits, can be a whisper of a problem.
So we're learning a new language?
Yeah.
The language of data whispers.
Exactly.
It's not just the screaming alarms, it's those subtle cues.
That's where it gets really interesting.
Yeah.
Because not all control charts are made the same.
Oh, really?
Yeah, there are different types for different data scenarios.
Okay.
Each with their own little quirks and nuances.
This is getting interesting. Tell me more about these different types.
Well, some of the most common in infection prevention are the U chart and the P chart.
Okay.
And choosing the right one really depends on the kind of data you're dealing with.
All right.
So are you counting events that can happen multiple times, like ventilator-associated events? Or are you tracking things that can only happen once to a patient in a certain time frame, like the first MRSA infection of the month?
So it's about using the right tool for the job.
Exactly.
Matching the tool to the data.
Yes.
Okay. Oh.
And then there's some other things to think about, too.
Like what?
When you're using these charts.
Yeah.
Like making sure you have enough data points.
Okay.
Understanding what run charts can and can't do.
Yeah.
And being really careful about how we handle those special cause variations.
Okay. This is starting to make sense.
Good.
But I feel like we're just scratching the surface here.
We are.
So we need to unpack these different chart types.
Definitely.
Talk about those other considerations.
Yes.
And really dive deep into how to use these in the real world.
For sure. And that's exactly what we'll do when we come back.
Right.
Get ready to unlock the secrets of the U chart and P chart.
Ooh, exciting.
Welcome back.
We're back.
And ready to talk about those U charts and P charts.
Yes, I am so ready to demystify these charts and figure out how to use them.
For sure.
So let's start with the U chart. When do we use this one?
So the U chart is great when you're working with count data.
Okay.
Those events that can happen multiple times to the same patient.
Okay, so give me an example.
Okay, so think of it like hitting the snooze button on your alarm clock.
Oh.
One person, multiple snoozes.
Yeah.
So in infection prevention, a good example is ventilator-associated events, or VAEs.
Okay.
One patient on a ventilator could have multiple VAEs during their stay.
Right.
The U chart helps us track the rate of those events over time.
So instead of just saying, like, this many patients had VAEs, we're looking at the overall rate of VAEs.
Right.
And comparing that to
the total number of ventilator days.
Okay.
Which is important because the number of patients on ventilators can change from month to month.
Right.
So the U chart takes that variation into account.
Gotcha. Okay.
Yeah.
So U chart for counts.
Yes.
What about the P chart? When do we use that one?
The P chart is really good when we're talking about things that can only happen once to a patient.
Okay.
In a given time frame, like a specific infection.
Okay.
So if a patient gets their first MRSA infection of the month, we mark it down.
Right.
But if they happen to have another positive culture later that month, we don't count it again.
So just that first occurrence.
Yeah.
Okay.
And the P chart helps us track the proportion of patients who experience that event. And like the U chart, it takes into account variations in the denominator.
Which in this case would be the total number of patients, right?
Not quite.
Oh.
It's usually a measure of patient exposure.
Okay.
Like the total number of patient days.
Right.
And again, that number can change from month to month.
Yeah, makes sense.
So the P chart helps us account for that.
Okay, so U charts for counts, P charts for proportions.
Exactly.
Got to choose the right tool.
You got it.
So what about those extra considerations you mentioned?
Right. So one thing is the number of data points.
Okay.
We need enough data to really get a good picture of what's going on.
So just like an artist needs enough brushstrokes.
Yes.
We need enough data points to tell the story
I love that.
of our infection trends.
Yes, exactly.
And the more data points we have,
the better.
The more confident we can be in those patterns. But it's not just quantity, it's quality too.
Yes.
We need accurate data.
For sure.
And it has to be collected consistently.
If you're putting garbage in, you're going to get garbage out.
Yeah, like trying to bake a cake with spoiled ingredients.
Exactly.
That's not going to turn out well.
Not at all.
Speaking of things going wrong, what are some common mistakes that people make when they're using these charts?
Oh, yeah, there are definitely some pitfalls.
What should we watch out for?
So one thing is changing those control limits.
Okay.
Like making them tighter. by using 2 standard deviations instead of 3.
Why would someone do that?
Well, it seems like it would help you spot problems faster.
Right.
But it actually leads to a lot of false alarms.
Oh, okay.
It's like setting your smoke detector to go off if someone lights a candle.
So you're always on edge.
Yeah, you're constantly on high alert.
But it doesn't mean there's a real fire.
Exactly.
So we could be spending time and resources on things that aren't real problems.
That's right.
Okay, what else?
Another mistake is forgetting to remove special cause data points after an intervention.
Oh.
So let's say you see a spike in infections.
Yeah.
You investigate and find out a new piece of equipment isn't being cleaned properly.
Okay.
You put a new protocol in place,
Mm-hmm.
the problem's solved, but you forget to remove those old data points from your chart.
So the control limits.
Yes.
And the average.
We're still being influenced by those old points.
Right.
It's like trying to use an old map to navigate.
You're going to get lost.
Exactly.
So data quality, control limits.
Yeah.
Keeping our charts up to date.
It's a lot.
It's a lot to keep in mind.
But it's powerful when you use it, right?
It is.
And it's not just about the numbers. It's about taking action.
Right, right.
And that's where the magic happens.
So how does using SPC change how we approach infection prevention?
That's a great question. And that's actually what we'll be talking about when we come back.
Okay.
We'll explore how it can shift the entire culture of infection prevention.
Ooh, I like that.
So we can make data-driven decisions.
All right, I'm ready. All right, so we're back, ready to wrap up this deep dive into statistical process control.
It's pretty amazing how these charts can really change how we think about infection prevention.
Yeah, definitely not just plotting data points.
Right. No, it's about getting everyone involved.
And before the break, you were talking about how SPC can actually shift the culture of infection prevention.
Oh, yeah.
In a hospital, that's a pretty big deal.
It is.
Can you tell me more about that?
Well, imagine a hospital where everyone's speaking the same language.
Okay.
The language of data.
All right.
That's what SPC can do.
How so?
It gives us a common way to understand trends, identify problems, and see how well our interventions are working.
So we're not just going with our gut feeling anymore.
No, we're all looking at the same data.
Right, same charts.
And using that to make decisions.
That makes a lot of sense. So this leads to a more collaborative approach.
Absolutely.
To infection prevention.
Yeah, so nurses might see a change in their unit's data and tell the IP team.
Okay.
Doctors might be more willing to try new protocols when they see the data backing them up.
And administrators can actually see where to put resources.
Exactly. So it's like a system of checks and balances.
I like that.
Where everyone's working together to keep patients safe.
And that feeling of shared responsibility is so important for creating a culture of infection prevention that actually lasts.
It's not just the IP team telling everyone what to do.
Right.
It's about everyone having the power to use data to make decisions.
And that can spread to the whole hospital, right?
Absolutely.
If we're using data for infection prevention.
It can become a mindset.
Yeah.
A way of thinking about continuous improvement.
I like that.
Always asking questions.
Mm-hmm.
Is this working as well as it could be?
How can we measure our progress?
Yeah.
That's really cool.
It is.
But let's be honest.
Yeah.
Putting SPC in place.
It's not always easy.
It can be tough, right?
It can.
What are some challenges you've seen?
I think one of the biggest ones is getting everyone on board with using data this way.
Okay.
Some people are scared of stats or don't like change.
It's new.
Yeah. And others might not really understand how SPC can help them.
So it's not just about...
It's about the why, not just the how.
Okay.
We have to show people how it can make their jobs easier, improve patient outcomes, and create a better workplace.
It's about making that connection between the data and what it means for people.
Exactly. And sometimes it's about starting small.
Okay.
Instead of doing the whole hospital at once,
Yeah.
maybe focus on one unit or one type of infection.
Show people the value.
Yeah, let the success story spread.
Like planting a seed.
I love that. And just like a plant, it needs to be taken care of.
Okay.
We need training, chances for people to share what they've learned, and celebrate the wins.
It's about building a community.
It is.
And when we give healthcare workers the tools to understand data, we can really make a difference in patient safety.
Absolutely.
This has been so insightful.
Oh, good.
I have a whole new view of how important data is for infection prevention.
I'm glad to hear that.
Thank you so much for all this information.
It was my pleasure.
And for anyone listening, remember that SPC is more than just charts.
It's a way of thinking.
Yeah.
Using data to always be improving.
So embrace the power of data.
Yes.
And keep those infections away.
That's the goal.
If you want to learn more about this,
Yes.
check out the show notes.
We've got all sorts of resources there.
Links to articles, guides, even some online tools.
So keep learning and keep sharing what you learn.
Yeah, we can all make a difference together.
Absolutely.
Until next time, keep diving deep, keep learning.
And may your data always be insightful and your patients always be safe.
Well said, and we'll see you next time.